Hi, my name is Sarah Bicknell. I'm a functional nutritionist. My company is called Csid Clinics. I started as a nutritionist about 7 years ago, just after my daughter was born and she was diagnosed with CSID. I was the lead in getting her diagnosed and then decided to move into functional nutrition and retrained with a nutritionist in America. So what is CSID? It stands for Congenital Sucrase Isomaltase Deficiency. This means that someone has a lack of the sucrase and isomaltase enzymes in their gut, which enable them to digest sugars and starches, which actually rules out pretty much about 90% of the food they can eat, as most vegetables and also fruit contain natural sugars, and these are a problem for somebody with CSID. They are unable to convert these sugars into glucose, which is needed by every cell in your body to thrive. CSID is a very rare condition. It affects probably between 1 in 500 and 1 in 2,000 people in the population, although we think that probably it is not as rare as we think. It is actually just rarely diagnosed, because many of the symptoms of CSID overlap with the symptoms of irritable bowel syndrome. So the symptoms of CSID manifest themselves in infancy, generally just after a child has started weaning, when they're exposed to foods which contain sugar and also starches. The symptoms are very distressed child that will scream non-stop because it's painful, an exhausted child who struggles to walk because they are really lacking in glucose, because those sugars are not being converted into glucose for their bodies. We often find burns across the buttocks and in the nappy area, where the food, which is undigested effectively, is very acidic when it leaves the body, and it causes these really painful burns and sores. Vomiting, copious amounts of diarrhea, these are all symptoms, and the child just really fails to thrive, which is the main symptom. So these really do overlap with a lot of other conditions. So it takes a very astute consultant or doctor or parent to realise that the foods that are causing a problem are those which contain either sugars or starches. So interestingly, something that isn't commonly known about CSID is that it is a condition that is genetic, and it is prevalent, very prevalent in Scandinavian countries and Iceland, in countries, in fact, where the Vikings were prevalent, because it's known as the Viking disease because their main diet would have been fish and meat and seaweed or green vegetables. So this condition very much stems from Viking heritage, and we see people with this condition have origins or roots from the Viking times. So how do we diagnose CSID? It is sometimes a very long and frustrating route to diagnosis because it mimics so many other conditions. The gold standard route for diagnosis is to have a disaccharide assay during a gastroscopy. It's where during a small bowel biopsy, where the tissue is analysed to see what the activity of the sucrase and isomaltase enzymes are. At the same time, lactase will also be analysed, and in line with the general population, approximately 50% of people with CSID will also struggle with lactase intolerance. and this is the gold standard for diagnosing. There are other ways which are less reliable, as they can produce false positives and false negatives, actually. And for example, a sucrose breath test is used in some countries by some consultants, but it is not considered as reliable a route. The way we treat CSID is by putting the patient on an elimination diet. So they have to remove all sucrose and sugars other than natural sugars from their diet, and many natural sugars, which are found in a lot of fruits and many vegetables. So there is a very long list of foods that they can't eat, but also a good list of natural foods that they can eat. And you really have to follow a whole food diet when you have CSID. Part of the treatment is to give the gut several months of gut rest. We generally recommend at least 6 months of gut rest with this elimination diet. And then after that, it is then very much testing how much sugar and starch can be tolerated. And this is quite a long process because it involves actually measuring out the amount or the grams of sugar that can be tolerated. And as soon as that patient is struggling with symptoms again, you know that that is the threshold over which they are going to become ill. There are other ways of treating it, which may include introducing a special enzyme into the diet. And in England, we have an enzyme called invertase, which is basically a food-grade yeast, which will effectively digest any excess sugars in your body, but also it will help your body to convert the sugars into glucose. There is another pill by a company called Intolerance, based in Holland, who produce an enzyme pill called Starchway, which helps with both sugars and starches. So this is something that's still being developed, but it is very much part of an accepted way to help the patient improve with CSID. And the results with these enzymes in place are, can absolutely change the health of the patient very radically and very quickly. To find out more about CSID, there is an excellent website called CSID Cares. It is run by Sucrase, which is the American equivalent of invertase. It's a sucrase enzyme. That has a good amount of information about the foods that can be eaten and tolerated by somebody with CSID. There is also my own personal blog about how we diagnosed my daughter Millie on my website, which is ZMed Clinics. And if you go to zmedclinics.com, and if you go to CSID and Me, which is part of on the menu of my website, you will be able to find a lot of information about CSID and links to various other websites such as CSID Cares. There's also a link to a YouTube video which I created as an educational tool for schools and for other caregivers and also families with children with CSID, which people have found extremely useful to explain a little bit more about what it is. Thank you.